Okay, we're just going to go in and administer Mr. Jarvis's insulin.
Okay.
Hello, Mr. Jarvis. Hello. I'm April. I'm your nurse today, and this is my student nurse, Sabrina. And
Hi.
we are just here to administer your insulin today.
Okay.
Okay? So, just make sure my hands are nice and clean.
Make sure the medication is compatible with.
All right. Do you have any allergies? No. No? Okay.
I'm just clamping it. And moving my normal saving back.
Okay, I see here you're scheduled for your insulin Glargine, and
Secondary. Select.
at 21:30. And I'm just going to go ahead and get that out, insulin Glargine. And I just need you to give me your name and your date of birth.
Ronald Jarvis, 3/24/59.
Okay, thank you.
Asking if it's all right. Yes, it's okay.
Actually, I'm going to have to do that again. Let me just get the medication up. One more time. And your name and date of birth.
Ronald Jarvis, 3/24/59.
Okay.
Hi there, my name is Jason. I'm a student nurse.
Just
Can
gonna
you tell me
check
a little
this
bit
against
about
the
this
mark.
patient?
And I'm going to check the expiration date. And I'm going to check the clarity, make sure there's no particles, no cloudiness, and it's nice and jolly.
She's an 80-year-old female Hispanic. She's admitted today with a stage 3 non-healing sacral ulcer, admitted for surgical debridement. She is 5'5" and 175 pounds, BMI 29.
Okay,
She's
and
known
according to the norm, we need to draw up 18 units.
Tonight. She has an IV in her right dorsal.
And do you have a
regular diet,
preference
standard precautions.
after that?
Currently, she is stable.
Yeah, the left side is
Kind of poor functional status,
I'm sorry?
The left
she
side
is
is
able
fine.
to
Left side,
take care of
okay.
herself at this time.
I'm going to draw
She's up with a walker, standby assist. Her vitals at
18 units
14,
there.
they did not take a temperature at that time, so that's something we're going to want to do today. Perhaps later, but we will want to do that. Her respirations are 24, pulse 88, blood pressure 144 over 90, pulse ox 92%.
Nurse, can you check?
6, and her
Looks good.
Okay.
and output of 350.
Her
Her medications are oxycodone, 5 milligrams with acetaminophen, 325 milligrams.
Just checking again, making sure the expiration,
PO, this is PRN.
clarity,
She
the
also
order,
has morphine
okay?
sulfate,
2 units of Glargine.
IV,
And,
every 2 hours, and that is
We
also
are going to put this in, you said the right upper
5
pocket?
milligrams PO, every night for sleep.
Did I forget anything?
Non-saline, with 20 ml equivalents of potassium chloride in 1,000
Well, the left
milliliters
side
of
is good.
25
The
milliliters
left
per hour.
side?
We're going to be
Okay.
doing that in just a bit here, as
Clean
well
from
as
the inside
gentamicin,
out.
80 milligrams. And then she's on Psilocybin, 8.6 milligrams PO at bedtime.
Triangle.
This yarn, she has a history of multiple admissions for dehydration as well as
How was that?
pneumonia.
All right, so we have
Her
that
last
done.
admission was 6
So
months
I'm
ago.
just going to
This
charge
patient does
that.
not smoke, no history of heart disease or other chronic illnesses. She's on a regular diet, but she does report a decreased appetite. She is widowed, she lives alone in a senior housing apartment. She has 2 adult children who live out of state across the country, and she rarely sees them. No surgical history. She does have a non-healing ulcer on her sacrum. She complains of dry, scaly skin. She uses lotion occasionally. She has this breakdown started 6 months ago after a previous hospitalization. She's been treated on an outpatient basis for the last 3 months without success. She's nice chest pain, palpitations, shortness of breath, no syncope or pre-syncope episodes. She verbalizes decreased appetite, no complaints of nausea, vomiting, change in stool pattern, consistency, or color. She complains of lower back pain, of an aching quality for the past 3 months.
All right,
This
and
pain is
now
usually
we're gonna
relieved by
give you your
sedative.
insulin, your
Her
regular
gait is
insulin.
coordinated, but a little bit slow. She does use
Did
a
you
walker
have
to get
something to
around.
eat?
She's a bit
Okay.
hard of hearing. Limited visual acuity, occasionally watery eyes, but no
All right,
complaints
and your
of
name
headaches,
and date of
changes of
birth
vision,
again.
nasal
Ronald
problems,
Jarvis,
or sore throat.
32459.
Multiple admissions for community-acquired pneumonia. The last of those was 6 months ago. She does have occasional stress incontinence with nocturia. She complains of
Okay,
generalized
regular
weakness, denies
insulin.
numbness beyond the sacral area though.
Make sure we have the right one.
She does
green.
report an
Wonderful.
increase in her fatigue and weakness, and she has been menopausal for 20 years,
All
20
right.
plus years. She is alert and
And
buoyant
since we
at this
did that in your
time,
right
and she is
upper
very
quadrant, do you
cooperative.
mind if
But
we,
she
or your
is
left upper
frail,
quadrant, do you
thinning
mind if we
skin, intact
put it in your
except for
lower
the sacral
left?
wound. It is a
Just
stage
kinda go around like a
3, it's
circle?
4 centimeters by 4
All right.
centimeters by 1 centimeter. The involvement of surrounding tissue is kidney shaped, serous exudate without unusual odor, no underlying tunneling or bruising. She does have poor skin turgor.
Okay, so we cleaned it
She does
off.
have a sinus rhythm with occasional
And,
breathing beats. Her
um,
GI, her
actually,
abdomen is
what I'd
soft,
like to do is check this
non-distended,
against the MAR
non-tender. She is
for
slightly
the
obese.
expiration date, the
No
clarity,
masses,
color.
vowel sounds present in all 4
Make
quadrants.
sure there's no
Her stool is
allergies.
brown.
Okay.
Her guaiac test is negative.
put
No
it one
rectal
more
masses,
time
no
for all of
lesions
that.
of inflammation in the perineal area.
For 15
Her head
seconds.
is normocephalic,
All right.
so she is symmetrical. She has 20/40 vision bilaterally, slightly hard of hearing. Her nares are pink.
And
her
we
mucus
are
is
going
pink,
to
no
draw
lesions,
up,
and her tonsils are present.
actually 16
Respiratory
units of
chest
this
function
because there's a
symmetric,
sliding
clear
scale and
auscultation
your
in all
blood
fields,
glucose was
anterior,
242.
posterior diminished
So we're
spaces,
gonna draw up
no
16
lesions or
units
inflammation in
of
her
the regular
perineal
insulin.
area. Her cranial nerves 2 through 12 are intact. Motor and sensory examination of the upper extremities is normal. Reflexes +1, symmetric bilaterally, and no
This needle
palpable,
is defective, so we're just gonna
lymph
go ahead and get rid of
Um,
that.
What we're gonna be doing is,
kind of
we do need
bizarre
to, today,
Go to the side. All right.
probably perhaps later, we are gonna do that. She does need to increase her protein intake because she has a wound, so she definitely needs that. We do need to plan for this debridement of her wound that she's gonna have tomorrow. We
Okay,
do have
16
some
units on the
results in lab
sliding
tests
scale.
that have come
Draw
in.
up the air.
She does have some protein in her urine. Her albumin is low at 3.2 grams per deciliter. Her BUN is high at 22 milligrams per deciliter. Her white blood cells are also high at 12.5. And the culture and sensitivity came back as E.
Nurse, can you check?
gram negative.
16 units?
Looks good. Which
Okay.
is definitely compatible with the gentamicin. Any questions for me?
Yeah, why specifically is this client receiving the medication?
She has
Okay.
this ulcer
And
on her
you
sacrum.
told me that you
and
ate your
it would
dinner.
appear that she might have
So,
an infection. Her
All
white
right,
blood
we're just
cell
gonna
count is
clean that
elevated,
lower left
and,
quadrant.
it is concerning because her albumin is low and she needs that for wound healing.
And what action does this medication have on the
On the
body?
count of 3.
This is a protein synthesis inhibitor. It's a bactericidal antibiotic. It works by
Okay.
irreversible
Is that all
binding
right?
to the 30S
Yes.
subunit of the
All
bacterial
right.
ribosome.
This
Is that too much?
We'll just document this.
When should you question administering this medication?
Definitely you wanna do the 5 rights, so you wanna make sure it's the right
Okay, and
patient,
that was
the
16
right drug, the right
units.
dose, the right time, the right route. It is
And I did tell you
contraindicated, of course, in
previously today that you had the
hypersensitivity,
right to refuse, so.
and also hypersensitivity,
Let's see, 16
particularly,
units.
to other
And the
aminoglycosides in the same
lower.
class. You're gonna use it cautiously in issues of renal impairment. Hearing impairment, we definitely wanna watch for ototoxicity with this. Certain sorts of, yeah, definitely the ototoxicity.
All right. Now,
Does this medication have a therapeutic serum level?
got my
That's
trash
gonna be
can.
5
Wash
to
my
8
hands.
micrograms per milliliter.
And anyway, I
Which
just wanna do a
vital
little
signs do you need
teach
to
back.
monitor?
Just to make
I'm
sure
gonna
that,
have to monitor
you know, I'm
all
sure
of
you're
them.
familiar, but I just
You
like
can
to make
get
sure. Do you
overgrowth
know how to store your insulin
other
after it's been open?
organisms. So I'm gonna go ahead and take everything,
Mhm,
heart
I
rate,
can
blood
store
pressure,
it at
temperature,
room
respiration,
temperature.
and says for pain.
Up to
Which
30
physiological
days.
parameters
Okay.
should you
And do you know
monitor?
what your
You're
insulin should
definitely
look
gonna
like?
wanna,
In the
assess
vial.
for
Clear,
signs and symptoms of
no
infection.
particles.
So, you know,
Okay.
redness.
And, when do you
any sort of,
administer your normally?
irregularities
your
with
regular
her stool or
insulin.
urine. We're gonna wanna keep a close watch on her.
When?
After your
Red
dinner?
blood cells.
Yes.
Oh, okay.
Definitely
Great.
evaluate
All right, let me
her
just,
cranial function to make sure that she's not having any kind of autotoxicity.
Document
Definitely
that
watch her ins and outs because we want her well hydrated while she's
patient
on
teaching.
this medication.
Actually, I'll do that when I go out. Okay, I've washed my
We're
hands.
supposed to be
And
monitoring her blood.
put your bed back up.
30 minutes
Here's your
after
call
the
light. Do you
infusion
need
to
anything? Is there anything we
check
can get for you?
toxicity.
No, I'm fine, thank
Okay,
you.
all right, thank you. Just
Okay.
let us know,
What
push the call light if
interventions
you
do you
need
need to
anything.
teach
Okay.
to the
All right.
client for it to be administered safely in the hospital?
All right,
and-
now since I've already answered all of your
Yeah,
questions,
we're definitely gonna want to make
we're
sure
done,
that
but
she
maybe
Okay.
you can follow me again around tomorrow.
All right, I appreciate it. Thank you
Okay,
so much.
thank you.